Hi, my name is Melissa Zambrano. I'm studying medicine. I'm in 5th semester, and I'm going to talk about a role of hydrocortisone therapy in septic shock. Definition. The authors note that the role of adrenocorticosteroids in the management of infectious disease has been a subject of most controversy, although corticosteroids breed resistance to infections by reducing inflammation. Corticosteroids have been shown to be anti-endotoxic and antipyretic, and to influence vascular activity in a manner that may conceivable by beneficial to the infected individual.
Hello YouTube, Dr. Carlo Ojeda here, board certified emergency physician with EDXit Video Pro. If you give me 5 minutes, you will learn something new with every video, so make sure you subscribe. In this video, we're going to discuss an article from the JAMA, Journal of the American Medical Association, published in 2016, having to deal with hydrocortisone and septic shock. Does hydrocortisone given in the IV form help prevent progression to septic shock? Well, the current guidelines are if that a patient is in septic shock and using vasopressors, hydrocortisone given in the IV form is beneficial to patients. So, to answer the questions, can hydrocortisone prevent the progression to septic shock? A randomized, double-blind control study was done in Germany with almost 400 patients, given hydrocortisone IV for 5 days and a tapering dose over the next 11 days. This was called the HIGH-PRESS study, high for hydrocortisone prevention, PRE, of septic shock. And the bottom line, the answer is it did not show any benefit. It did not show any difference in the prevention to the development of septic shock. However, most critics of this research article say that the power of the study was too low. That means if they were to do a study in 4,000 patients instead of 400, there might be a difference. But the bottom line, the conclusion of the study is this. We already know that in septic shock, patients already on vasopressors for the treatment of septic shock, hydrocortisone IV is a current guideline of treatment. The question is whether or not there's a benefit into the prevention of development of the septic shock. Well, they failed to show any benefit. However, they failed to show any disbenefit or any complications from it. So what they suggest is if the patient is in sepsis and you're already starting to think about starting vasopressor, that means in the early development of septic shock, you might as well start the hydrocortisone because there is no evidence against it, although the evidence for it is not that good anyway. So that's it. Conclusion, there is no data showing benefit, but it doesn't hurt. If you're thinking about vasopressors or if you're already on septic shock, go ahead and give that IV hydrocortisone to those patients. I hope you learned in this video. Subscribe, comment, like, and we'll see you in my next video. That was actually
Application in medicine. Clinical practice guidelines in medicine have access to benefits and risks of corticosteroid therapy in sepsis and sepsis shock, with dose to range for stress dose 200 to 300 milligrams of hydrocortisone per day for 5 to 7 days, of pharmacologic dose that were 10 to 40 times at grade at the stress dose and were given over a period of 1 or 2 days.
Welcome to this research update and brief. It's 28th of August 2017. In what is a remarkable study in regard to increasing survival of individuals with sepsis or septic shock. We're just going to go right to the citation title because it actually says it best. Citation is as follows: hydrocortisone, vitamin C, and thiamine for the treatment of severe sepsis and septic shock. Now keep in mind the vitamin C utilized here was intravenous vitamin C. to quote the study parameters as follows. There were 47 patients in both treatment and control groups with no significant differences in baseline characteristics between the two groups. Now I'm going to reverse the figures here for the sake of impact. All right, the mortality rate in the control group was 40.4%. The mortality rate in the treatment group receiving vitamin C, thiamine, and hydrocortisone was diminished down to 8.5%. Now, to quote why the researchers believe this is so is as follows. Investigators believe the combination of vitamin C, hydrocortisone, and thiamine works synergistically to reverse the pathophysiological changes of sepsis. Vitamin C is a crucial antioxidant, vital to preserving endothelial function and microcirculatory flow. Predictably, patients with sepsis have very low serum levels of vitamin C that can only be corrected through the administration of intravenous vitamin C. In the study, patients were given 6 grams of vitamin C per day for which no complications or side effects were reported, along with hydrocortisone doses according to the consensus guidelines of the American College of Critical Care Medicine. Thiamine, interesting also, was included to combat the thiamine deficiency, which has been linked to an increased risk of death in patients with sepsis. Now, another interesting result, I'll refer to the screen real fast, they said as follows. The sepsis-related organ failure assessment score decreased in all patients in the treatment group, the one receiving the vitamin C, the thiamine, and the hydrocortisone, with zero, developing progressive organ failure. To further go into the study, our research suggests that early use of intravenous vitamin C together with corticosteroids and thiamine were effective in preventing progressive organ dysfunction with thiamine, including acute kidney injury and reducing the mortality of patients with severe sepsis and septic shock. Additional studies, of course, are required to confirm these preliminary findings. Again, when you look at that result, when you go from actually having a 40.4% mortality rate down to an 8.5%, diminishing down to an 8.5% mortality rate, and this was just with researchers seeing if it worked. This means this formula can be even tweaked even further in the future, reducing the mortality rate even down greater. An incredibly breathtaking, beneficial study altogether. This is Ralph Turchiano signing off. It is the 28th of August, it's 2017, and as always, thank you very much for listening, and I'll catch you all next time. See you then. Bye.
Pros and cons. Pros. One systematic review summarized the effects of corticosteroids in 33 randomized controlled trials in sepsis and conclude that low-dose corticosteroids reduce 20-day mortality, increase shock severity, and reduce organ injury scores. Cons. In contrast, another systematic review concluded that majority of trials have a high rate of bias were underpowered and overall did not detect a beneficial effect of high-dose or low-dose corticosteroids in sepsis shock.
The medical team in this intensive care unit at Mayo Clinic is on high alert 24/7, watching for signs of sepsis.
Sepsis is a potentially life-threatening complication related to an infection.
Dr. Canon Ramar says every year close to 750,000 people in the U.S. develop a septic reaction. It happens when an infection prompts the immune system to kick into overdrive, causing problems such as kidney failure, liver failure, severe drops in blood pressure, and even death.
It becomes very important that this is recognized early.
That's because the death rate can be very high, up to 75% for people who develop sepsis at home and up to 25% for those who get it in the hospital.
It's almost similar to treating a heart attack or a stroke, where you have a very short window
That window is 6 hours. Dr. Ramar's team uses what are called sepsis sniffers, technology that monitors things like fever, heart rate, and blood pressure, and alerts the medical team when a patient's in danger.
Okay, I think let's go ahead and activate the sepsis response team.
We have a patient in room number 20. We want to activate the SRT.
If blood tests confirm that's true, the septic response team launches into action.
It's a big multidisciplinary approach to do this. And so all members of the ICU team are actively involved to get this aggressive resuscitation going and to get all things done within that 6-hour window period. Let's get the central line ready.
We did give a dose down in the ED, so continue with that.
We follow what we call as the surviving sepsis resuscitation guidelines.
Methods of best practice developed by the Society of Critical Care Medicine to ensure the best possible treatment for patients.
If the necessary things are done, then the mortality drops down dramatically.
Sniffing out sepsis and saving lives. For Mayo Clinic News Network, I'm Vivian Williams.
Issues applied in medicine. Because of the story and debate the role of extravagant low dose hydrocortisone treatment 200 or 300 milligrams for in patients with severe sepsis and sepsis shock remains controversial in Ecuador. The adjunctive corticosteroid treatment in critically treated patients with sepsis shock, adrenal, trial 5 and active protein C and corticosteroids for human sepsis shock approach trial 6 are landmark stories describing the large compresses analysis and hydrocorticosteroids effects in clinical treated medical and surgical patients with sepsis shock.
Hi, my name is Nalay Patel and I'm one of the chief medical residents for the Department of Medicine and one of the inpatient attendings in the Department of Medicine. Over the past few years, there's been an increasing concern about the care delivered to septic patients. We learned that sepsis is a leading cause of inpatient mortality, accounting for more than 1.5 million hospitalizations and over 250,000 deaths per year. While there is no simple test to diagnose sepsis or a single therapy to reverse its harmful side effects, research has documented that rapid identification and treatment can save lives and reduce long-term impact on survivors, which has spurred regulatory efforts to protocolize care. MGH is committed to improving the timely detection and treatment of sepsis. Through a collaboration with Partners Hospitals and the Partners eCare team, we are working to build knowledge around the condition, treatment expectations, and resources to support safe and effective sepsis care. One such resource is a new EPIC best practice alert, also called a BPA, that analyzes elements in the electronic chart, such as vital signs and cultures, to flag patients who meet the criteria for possible sepsis and septic shock. The sepsis BPA provides real-time decision support mapped to the clinical stages in the partner sepsis pathway, our gold standard for sepsis care. We just finished piloting the BPA with more than 100 responding clinicians and nurses across MGH, and after making several improvements based on their feedback, are preparing to launch the BPA on February 21st. Trish, you've been a key contributor to the creation of the pilot for the BPA. As a nurse in the Department of Surgery, how do you see the BPA impacting your day-to-day workflow?
So the alert will help bring possible sepsis to our attention and encourage timely communication with responding clinicians. It will ensure that everyone is aware of the patient's condition and that the appropriate actions are taken place. The BPA has been purposely designed to identify high-risk patients in order to prevent overfiring, but it does not mean that you stop using your clinical judgment. It is important to remain vigilant. If you're worried about a patient, don't wait for the BPA, contact your responding clinician.
Excellent. Dan, you're a resident in the emergency department, which is one of the areas where the BPA will be working and active. Could you tell me where else it would fire and how it'll impact your day-to-day workflow?
Sure, Nalay. The BPA is configured to fire in the ED, but also on all adult inpatient floors, except for the ICUs and the ORs. It will prompt providers to consider a diagnosis, and if we deem appropriate, enable us to add sepsis to the problem list with just a single click. It also provides a shortcut to several tools to help monitor and manage septic patients, such as the sepsis order set and flow sheet. I anticipate that the BPA will help us manage septic patients, increase the use of these tools, which are already live in EPIC. I should note that the alert captures vital signs that are abnormal, that are a warning sign for clinical decline, not necessarily sepsis, to include things like pulmonary edema. So in summary, I think that the BPA will help bring sick patients to our attention sooner and ensure that we as responding clinicians are providing standard and timely sepsis care when it's appropriate.
It sounds like the BPAs will help to strengthen the clinical response to sepsis and communication tactics. Thank you both for your leadership. As I mentioned before, the go-live date for the BPA will be Wednesday, February 21st, and the entire care team will be expected to work together to respond. We appreciate your hard work and are interested in your feedback as the BPA rolls out across the institution. There will be a hyperlink in the BPA to submit comments on its behavior and technical design. If you have questions or feedback on the clinical workflow, please contact the sepsis champion in your care group. Thank you in advance for your insights.
Conclusion. The doctors will have to use this data and subsequent meta-analysis to decide how best to treat patients with sepsis shock. Estimating 90 days mortality at the bedside is not practical. It is likely that some practitioners caring for a patient with a deteriorating condition who is receiving escalating dose of vasopressors, in whom other core interventions have been instituted. For example, appropriate antibiotics and adequate volume of resuscitation and sources control. We'll consider that there are short-term benefits of low-dose hydrocortisone may exceed any risks, for example, anti-inflammatory effects, as an added therapy in sepsis patients.
Tonight, a possible medical breakthrough discovered right here in Norfolk, and it could save millions of lives.
Yeah, how about that? A doctor at Eastern Virginia Medical School believes he's found the cure for sepsis, a common infection that gets into the blood and kills 1,000 people a day in the U.S. alone. At 10 on your side, Stephanie Harris spoke with the doctor this morning, and Steph, it's a really big deal.
Yeah, you know, pharmaceutical companies have been trying for years to come up with a drug that would kill sepsis, so needless to say, they're probably not very excited about this because Dr. Paul Merrick's discovery is cheap and readily available.
It's really cool, I think, because nobody's going to make any money from this, hopefully, and it has the potential to save millions of lives, which I think is the coolest thing.
Dr. Paul Merrick's discovery came by chance when a deathly ill sepsis patient came into Centera Norfolk General's ICU last January.
I just knew she was going to die, and when you're in a situation like that, you try to think out of the box,
He decided to try a combination of vitamin C and the steroid hydrocortisone.
We gave it to her, not expecting anything would happen, and I went home expecting she would pass away.
But when he returned the next morning, he found a woman well on her way to recovery.
And I said, oh my gosh, what just happened there?
The staff couldn't believe it, so they tried it again and again, adding a third element, thiamine, to the IV treatment.
Up to date, treated about 150 patients, and we see the same thing over and over again.
A researcher at Old Dominion University did an independent lab study that confirms the treatment's effectiveness. Dr. Merrick admits more studies must be done to validate the findings, but to those naysayers, he says,
you really have nothing to lose. It's exceedingly safe. So, those people who maybe are skeptics, there's no side effect.
He says seeing is believing, and he's seeing more lives saved every day. And Dr. Merrick told me all about why they think this works. You can see our full interview and read his paper just published in the medical journal Chest on wavy.com. Stephanie Harris, 10 on your side.